focus for this week is the urinary system. Where can you find the objectives? In the objective section of the module. What does the urinary system do? Well, it helps with homeostasis. And what is homeostasis? It's the maintenance of a stable internal environment. It does this by maintaining the balance of water, electrolytes, and acids. It filters the blood to remove waste products, produces urine by converting wastes into water. The process where the body maintains a constant internal environment. Homeostasis, we just said that in the first slide. The urinary system is made up of 2 kidneys, 2 ureters that lead into 1 bladder with 1 exit tube called the urethra. The adrenal glands are part of the endocrine system, but sit on top of the kidneys. The genitourinary tract is often referred together as both the tracts, urinary and reproductive, are next to each other. Here you see the structures in the body as you look at the male in the anatomical position. Here's the kidneys, 1 on each side. They each have a tube coming out called the ureter, and both ureters lead into the bladder. The tube that leads out is the urethra. The kidneys filter blood and remove waste and water. Processes almost 200 quarts of blood a day, producing almost 2 quarts of urine. It's located in the retroperitoneal space. The cortex is the outer portion of the kidneys and contains the nephrons. Nephrons are the functional units of the kidneys. The medulla is the inner portion of the kidneys and contains the tubules. This is a depiction of the structure of the kidneys. Here's the cortex. This is the medulla. Here's the pelvis. And here is where the ureter connects. This is a view of the nephron and the tubules. The pelvis is the funnel-shaped area at the very inside of the kidney that we saw on the last slide. The ureters are the 2 tubes that connect the kidney to the bladder. What is the cortex? It's the outer area of the kidney that contains the nephrons. Another structure is the bladder. That is a hollow and muscular sac that holds urine. It's in the anterior portion of the pelvis behind the pubic symphysis. There are many folds or rugae that allow the bladder to expand and contract to fill and empty. Here's a diagram of the bladder in the male. The urethra is the tube that leads from the bladder to outside. There are 2 sphincters. The opening of the urethra to the outside of the body is called the meatus. Female urethras are 1.5 inches long, and the males are 8 inches long. Which is the name of the external opening of the urethra? Meatus. Urination is peeing, also known as voiding and less commonly known as micturition. Urination is a coordination of contraction and relaxation of muscles and sphincters that allow for the release of urine from the body. The urge to urinate is called micturate. Here are some specialists for the urinary system. Who diagnoses and treats kidney disease? A nephrologist. Nephr is kidney, and ologist is a specialist. Nephro is kidney, and pathy is disease. So nephropathy is kidney disease, including degenerative and inflammatory. Diabetic nephropathy is kidney disease that's caused by diabetes. Renal failure is when the kidneys fail, when too many nephrons become non-functional due to damage. Azotemia is an increase in BUN. When this reaches toxic levels, it is called uremia. Uremia is where urea and waste are not secreted normally in the urine and are retained in the blood. Acute renal failure is exactly what it sounds like. Chronic kidney disease is progressive loss of function over time. The slow buildup of waste products can lead to an increased risk of heart attacks or stroke. End-stage renal disease is also kidney failure. Nephrotic syndrome or nephrosis is a group of diseases where excessive amounts of protein are lost in the urine, usually because the glomeruli are damaged. Causes can be from diabetes or infection commonly. Edema is swelling due to fluid accumulation in the tissue. Hyperproteinuria is excessive protein in the urine. Remember, hyper is excessive. Hypoproteinuria is low levels of protein in the blood, and hypo is decreased. Ectopic kidney is where one kidney is located in an abnormal space or fused with the other, and it's something you're born with. Hydronephrosis is a swelling of the kidneys. Nephritis is inflammation of the kidneys. If you don't know what itis means by now, you have not been paying attention. Glomerulonephritis is inflammation of the glomerulus that causes red blood cells and proteins to leak into the urine. Pyonephrosis is separation of the kidney. What the heck is separation? Polycystic kidney disease is a genetic disease where the kidney is filled with many fluid-filled sacs, or cysts, as in this picture. Doesn't leave a lot of room for normally functioning tissue. Renal colic is spasm that occurs with kidney stones as the structures try to get the stones out of the system. Super painful. Renal carcinoma is kidney cancer, and a Wilms tumor is a rare form of kidney cancer in young children. Stones are mineral deposits within the body and named for the organ where it's at. Like kidney stone is in the kidney. Gallstone is in the gallbladder. They occur when waste in urine separates and crystallizes. So nephr is kidney, lith is stone, so nephrolithiasis is kidney stone. A urinary tract blockage blocks the urine from coming out, and it's named for the location. They are usually stone, birth defects, or enlarged prostates in the older male. Nephrolith, as in the previous slide, is the kidney stone. Ureterolith is a stone in the ureter, and the cystolith is a stone in the bladder. Disease of the ureters include hydroureter, which is when the ureter is distended because it is blocked and filled with urine. Ureteral obstruction we just covered, and ureterorrhagia is blood from the ureter. Disorders of the bladder, look at the root. Cyst is bladder, algia, and so is dynia. Means pain. So cystalgia or cystodynia is painful bladder. Cystocele is a prolapsed bladder where the bladder herniates through the vaginal wall. Interstitial cystitis is a chronic infection of the bladder. And vesico-ureteral reflux. Where do you think that occurs? Vesico also refers to the bladder. So look at the junction where the bladder and the ureters meet. There is backward flow. A vesicovaginal fistula is an opening between the bladder and the vagina. Urine constantly leaks from the bladder through the vagina. A neurogenic bladder is an abnormal nerve pathway associated with urination that causes the bladder to empty spontaneously, causing incontinence and preventing it from emptying all the way. Causes can be inflammation of parts of the nervous system, such as multiple sclerosis, neurological disorders, or trauma. And what can go wrong with the prostate? Well, let me tell you. You can have a hyper, remember excessive, plasia, as in benign prostatic hyperplasia, which is a fancy term for enlarged prostate. Prostatism is a compression or obstruction of the urethra. You can have cancer there like you can have it anywhere, and it can be inflamed, sometimes due to bacteria. For the urethra, you can have bleeding, urethragia, or discharge, urethruria. The opening can be narrowed, called urethrostenosis, or the opening can be located in an abnormal position, like on the top of the penis or next to the clitoris, as in epispadias. Or in hypospadias, the opening is on the underside of the penis or in the vagina. Super common for females, not so much for men. UTI is an infection anywhere in the urinary tract, usually by a bacteria. It can cause sepsis or a systemic infection called urosepsis. Cystitis. Tell me what that is. Cyst is what? Bladder. Itis is inflammation, so inflammation of the bladder. Pyelonephritis is inflammation of the kidney, and urethritis is inflammation of the urethra. See the pattern? Problems with urination are A is without, so anuria is without urine. Diuresis is increased urine. Dysuria is painful or difficult urination. Enuresis is involuntary urination. Nocturnal would be that happening at night or during sleep. Nocturia is excessive peeing during the night. Oligo is fewer or less. So oliguria is low urine output. Poly is many, so polyuria is a lot of urine. Hesitancy is just that, hesitant to start peeing. Retention is just that as well, holding on to the urine so you don't completely empty the bladder. Incontinence is uncontrolled urination or defecation, which is pooping. There are different kinds of urinary incontinence. Overflow, where you are leaking all the time. Stress incontinence is when you leak urine when there is stress on the pelvic floor, like when you sneeze, cough, or jump. An overactive bladder or urge incontinence is when your bladder muscles spasm involuntarily. What is the backward flow of urine? Well, what word is backward flow? Reflux, so vesico-ureteral reflux. How do we test for urinary problems? We do a urinalysis to determine if there are any abnormalities. We can test for GFR via a blood test. We can ultrasound the bladder and the kidneys. We can catheterize the bladder by inserting a catheter into the bladder through the urethra. No fun. Or we can do one better by inserting a scope for direct visualization. We can perform a CT scan or cystogram or an IVP, all which use X-rays to help us visualize the urinary system and how it's working. Other x-rays are a KUB, pyelogram, or voiding cystourethrogram. For males, examination of the prostate includes a manual exam or a blood test. PSA testing measures prostate-specific antigen to determine cancer risk of the prostate. GFR is a blood test to check how well the kidneys are filtering the blood, essentially how well the kidneys are functioning. Medications used to treat diseases of the urinary system include diuretics to increase urine output and eliminate extra fluid and salt. Antibiotics are used to treat infection. Antispasmodics are used to treat incontinence. Dialysis is a treatment where the blood is filtered using something other than the kidneys. Hemodialysis is where a machine is used to filter the blood. Peritoneal dialysis is where you use the lining of the abdominal cavity to filter the blood. Continuous is where the dialysis continues throughout the day, and cyclic is where the dialysis occurs at specific times during the day, like during sleep. Treatment of disorders of the kidneys can include nephrolysis, where scar tissue is removed from around the kidneys. Nephrostomy is where a catheter is placed to drain the kidneys to outside of the body. Pyelotomy is an incision into the renal pelvis to remove an obstruction. You can also have a transplant. Lithotripsy is use of ultrasound waves to break up urinary stones, and nephrolithotomy is a removal of a kidney stone. The ureters or ureters can be removed through ureterectomy. You can always put a scope in there via ureteroscopy. A bladder can also be removed. It can be sutured, called cystoscopy, to fill a defect. And stones can also be removed via incision, just like in the kidney, through lithotomy. What's the most common type of dialysis? Hemodialysis. Look at all the dialysis clinics popping up everywhere. It's big business, unfortunately. You can treat the bladder by catheterizing or putting a catheter in there. A catheter is a tube. It can be temporary or permanent. It can be through the urethra or through an incision just above the pubic bone. For the urethra, you can enlarge the opening through meatotomy. You can repair it via urethroplasty, or you can make an incision in it called urethrotomy. For the prostate, you can remove part of it or destroy its function via ablation. You can use hormones, heat, or chemicals, cautery, or surgery. Removal of the prostate or prostatectomy can be done surgically via TURP, as shown here. Incontinence is treated by strengthening the pelvic floor via Kegel exercises or bladder retraining. I'm just going to pronounce these for you. Polyuria, pyelonephritis, ureterorrhagia, extracorporeal shockwave lithotripsy. Which is the correct spelling? Pyelonephritis. Here are some common abbreviations. What is a TURP? Transurethral resection of the prostate, TURP.